Here is the complete, ready-to-record YouTube script, voiced by Dr. Patricia Holloway. Most of what you've been told about this topic is wrong. Not slightly off, not outdated, genuinely medically wrong, and some of it has been causing real harm in real people's lives for decades. I've been a urologist for over 22 years. I've sat across from hundreds of patients who came into my office carrying shame they didn't earn, anxiety they didn't deserve, and questions they had been too embarrassed to ask anyone else. And almost every single time, the thing they were afraid of, the thing they had been quietly worrying about for years, was built on a myth. So today, we're going to dismantle 6 of them, one by one. Before we do, I want to tell you about a patient of mine, 26 years old, came in for what he described as a routine checkup, but I could tell the moment he sat down that there was something else. He was quiet, kept his eyes on the floor. Finally, after about 10 minutes of small talk, he said, "I think I've damaged myself." He'd read something online. He was convinced that his habits had permanently lowered his testosterone, ruined his fertility, and were the reason his relationship was struggling. He'd spent 6 months believing that. 6 months of guilt so heavy it was affecting his sleep, his confidence, his sense of self. Nothing was wrong with him. Medically, nothing at all. But what had been done to him, by misinformation, that took longer to undo. That's why I make these videos. Not to shock anyone, not for views, because that young man deserved accurate information, and he didn't have it. And if you've ever felt even a fraction of what he felt, you deserve it too. Let's start with the one I hear most often. Myth number 1. You can permanently damage yourself if you do it too much. This is the granddaddy of masturbation myths. The one that has been recycled across centuries, across cultures, across generations. Victorian-era physicians used to prescribe cold baths, bland diets, and in some documented cases, surgical interventions to prevent what they called self-abuse. They genuinely believed it caused blindness, insanity, and physical deterioration. That belief system was passed down. It found its way into religious teaching, into parenting, into locker room whispers, and eventually onto the internet, where it mutated into a modern version of itself with new vocabulary and new pseudoscience attached. The truth is simpler and less dramatic than any of that. The human body is not fragile in the way this myth assumes. I always explain it to patients this way. Think of masturbation like jogging. If you jog every day, you might get tired. You might get sore. If you push through pain and ignore your body's signals, you could develop a minor injury. But jogging does not destroy your cardiovascular system. Your heart does not get weaker from use. And if you rest, the soreness resolves. Your body resets. The same logic applies here. The only physical risk from frequency is temporary. Mild chafing, soreness from friction, nothing that wouldn't resolve with a day or two of rest. According to research published in the Journal of Sexual Medicine, there is no established evidence that any specific frequency of masturbation causes organ damage, hormonal depletion, or structural harm to reproductive tissue. The damage this myth causes, though, that's real. And it lives in the mind, not the body. If you've ever worried about this, you are not alone. Drop a 1 in the comments. I genuinely want to know how many people are carrying this one. Myth number 2. It lowers your testosterone. This one has gained a second life online in the last several years, particularly in certain male wellness communities. The claim is that ejaculation depletes testosterone, and that abstaining from masturbation raises it significantly. Some people take it further, claiming that if you abstain long enough, you'll experience superhuman energy, confidence, and physical performance. I understand why it's appealing. It offers control. It offers a framework. It tells you that if you just discipline yourself, you'll be rewarded with something measurable. The science doesn't support it. What we do know is this. Testosterone does fluctuate over the course of a day, over weeks in response to sleep, stress, exercise, diet, and age. A 2021 review published in Translational Andrology and Urology found that short-term abstinence, roughly 7 days, produced a modest temporary spike in testosterone levels. The key word there is temporary. It returned to baseline. And that baseline didn't change. Chronic, long-term abstinence does not cause sustained testosterone elevation in healthy men.
Think of it like holding your breath. Yes, briefly, your oxygen levels change. But your body corrects. It always corrects. The system is self-regulating. Now, are there real causes of low testosterone? Absolutely. Obesity, chronic stress, poor sleep, certain medications, and aging all have documented significant effects on testosterone levels. Those are the conversations worth having. Those are the levers actually worth pulling. The frequency of masturbation is not one of them. Myth number 3. It causes erectile dysfunction. This one causes the most damage. I've seen it. Men in their 20s and 30s convinced they've developed a medical condition, convinced something is broken because of something they read in a forum at 2 in the morning. Let me be precise here because precision matters. There is a real phenomenon called porn-induced erectile dysfunction, or PIED, and it is worth understanding clearly because the nuance is often lost. The mechanism is psychological, not physiological. What research suggests, including a widely cited 2016 paper in Behavioral Sciences, is that for some individuals, prolonged exposure to high-stimulation pornography can recalibrate the brain's reward system. The dopamine pathways that respond to novelty and visual stimulation become accustomed to a very high level of input. Real-world intimacy, which is less visually novel and more emotionally complex, can feel comparatively understimulating. The result, for some, is difficulty maintaining arousal in partnered situations. That is a psychological adaptation, not a permanent injury. Think of it like this. If you eat extremely spicy food every day for months, and then someone puts a bowl of lentil soup in front of you, it might taste bland. Not because your taste buds are damaged, because they've recalibrated to a new normal. And that recalibration can reverse. What causes actual physiological erectile dysfunction? Cardiovascular disease, diabetes, hypertension, medications, hormonal imbalances, nerve damage. These are the causes that need clinical attention, and they often go unaddressed while the patient is focused on the wrong thing entirely. If you are experiencing erectile difficulties, please see a urologist. Not because masturbation caused it, but because the real cause deserves to be found. But here's where it gets genuinely complicated, and this next one is the one I wish more people asked me about. Myth number 4. It has no health benefits. Most conversations about masturbation are framed entirely around risk. What can go wrong? What it might cost you? Nobody talks about what the research actually says about potential benefits, because that conversation makes people uncomfortable in a different way. The data is meaningful. A landmark prospective study from Harvard, published in European Urology in 2016, followed almost 32,000 men over 18 years. It found that men who ejaculated more frequently, 21 or more times per month, had a 31% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. This wasn't a fringe study. It was large, long-term, and peer-reviewed. The proposed mechanism involves regular flushing of the prostate ducts, reducing the concentration of potentially carcinogenic substances and inflammatory compounds. I always explain it to patients this way. Think of your prostate like a filter. Filters work better when they're used regularly. Ones that sit stagnant accumulate residue over time. There is also documented research on stress response. Orgasm triggers the release of oxytocin and endorphins. In controlled studies, these neurochemical cascades have been associated with short-term reductions in cortisol, the body's primary stress hormone. Sleep quality improvements have also been noted in some studies, particularly in relation to the muscle relaxation and temperature drop that follows orgasm. None of this means frequency is inherently better. It means the conversation has two sides, and the side that involves potential benefit has been largely invisible. Myth number 5. It ruins your relationship. This one is emotionally loaded in a way the others aren't, because it's not just about the body. It touches the relationship itself, the partner, the fear that something is being taken from them. I want to be careful here because I'm a urologist, not a therapist, and I say that honestly, not dismissively. Here is what I can tell you from a medical standpoint. Masturbation and sexual desire for a partner operate on largely separate tracks for most people. One does not automatically deplete the other. The body's capacity for arousal and desire is not a fixed reservoir that empties with use. Where problems can arise is not physiological, it's behavioral. If masturbation is being used to avoid intimacy, or if it's consuming time and energy in ways that are creating distance, those are relationship dynamics worth examining. But the behavior is a symptom of something, not the cause. I've had couples in my office who were in genuine crisis over this, and in almost every case, the actual issue was communication, or mismatched libido, or unaddressed emotional distance that had existed long before the question of masturbation ever entered the room. The relationship question is worth asking. Just make sure you're asking it about the right thing. Pause here for a second, because this is the question I actually get asked most often, even if it's never phrased this way. When does it become too much? Not medically dangerous, not physically harmful,
but too much in the sense that matters, the sense where something that should be neutral starts shaping your life in ways that concern you. The clinical term is compulsive sexual behavior, and it's real. The World Health Organization included it in the ICD-11, the International Classification of Diseases, in 2019. The diagnostic criteria include persistent, escalating urges that feel difficult to control, masturbation continuing despite negative consequences to relationships, work, or daily function, distress that isn't just guilt, but genuine impairment. What this is not is a moral failing. It is a behavioral pattern that for some people, not most, but some, reaches a threshold where professional support is genuinely useful. Cognitive behavioral therapy has a strong evidence base for this. So does acceptance and commitment therapy.
If you find yourself watching this video because something feels off, not because you read a forum and got scared, but because in your own honest assessment, something in this territory is creating real interference in your life, that instinct is worth listening to. A therapist who specializes in sexual health is not going to judge you. They've heard it before. They know where to help. That feeling of not knowing who to talk to, of carrying something that feels too embarrassing to say out loud, you don't have to keep sitting with that. Myth number 6. Talking about it openly is inappropriate or unnecessary. This is the quiet one, the one that enables all the others. Because every myth on this list survives in the dark. It lives in the space where people are too embarrassed to ask a doctor, too ashamed to Google it with their name attached, too uncertain to bring it up with a partner. The misinformation doesn't survive scrutiny. It survives silence. I started making videos like this one because I noticed something in my clinic. Patients would come in with questions they've been carrying for years. Months of anxiety that could have been resolved in a 10-minute conversation. And the only reason they hadn't asked sooner was that no one had ever signaled to them that it was okay to ask. That silence has a cost. When accurate information isn't accessible, people fill the gap with whatever they can find. And the internet, for all its reach, is saturated with content designed to frighten, to shame, or to sell something. The myths I've walked through today aren't random. Many of them have financial ecosystems built around them. Supplements promising testosterone optimization. Programs promising to rewire your brain. Entire industries built on manufactured pathology. You deserve better than that. Remember that young man I told you about at the beginning? 26 years old, 6 months of unnecessary shame, convinced something was broken that was never broken to begin with? He came back 3 months after that first appointment. He looked different. Not because anything had changed medically, but because the weight had lifted. He'd talked to his partner. He'd stopped catastrophizing. He'd slept better. He said, "I wasted 6 months being afraid of something that wasn't real." 6 months. I think about that a lot. Not because his story is unique, but because it isn't. Because somewhere right now, there is someone lying in the dark, in the quiet, turning something over in their mind that they don't have to carry. And if this video reaches them, if it reaches you, then it did what it was supposed to do. If anything in this video gave you something you needed, a fact, a permission slip, a breath of relief, please share it. Not for the channel, for the person in your life who needs it and doesn't know they need it yet. Tag them. Send it quietly. You might be giving them something they didn't know they were looking for. And if you have a question I didn't answer, leave it in the comments. I read them. I respond when I can. And the right question from one person might become the next video that helps 1,000 others. Take care of yourself, and take care of each other.